For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you a hope and future. So clearly God had plans for me to be a speech therapist, but those weren't my plans. Welcome back to my channel. My name is T.Slater and I'm a speech-language pathologist. Speech therapist, speechy, speech pathologist, SLP, CCC-SLP is basically all the same. So I made 2 videos that talked about how I paid off my car and how I paid off my credit cards. And everyone wants to know, what do you do for a living? I decided to make this video so you can learn a little bit more about my career as a speech-language pathologist. So what exactly is a speech-language pathologist? A speech-language pathologist is a clinician who works to prevent, assess, diagnose, and treat individuals with speech, language, pragmatics, cognition, and swallowing disorders. In order to be a speech-language pathologist, you have to have a 4-year degree. Your 4-year degree does not have to be in a speech-related program. My bachelor's degree is in broadcast journalism, completely unrelated to the field of speech-language pathology. So if you're like me and you do not have a bachelor's degree in speech-language pathologist or communication sciences and disorders, then the program that you select for grad school, they may require you to take a few courses prior to being accepted into the graduate program or alongside being in the graduate program. There are communication sciences and disorders program all over the country. You have Georgia Southern University, that's in Savannah, Georgia. You have Valdosta State University, that's in Valdosta, Georgia. You have the University of Georgia, which is in Athens, Georgia. There's also Georgia State University in Atlanta, Georgia. And you have the University of West Georgia in Carrollton, Georgia. The state of Florida has a ton of different schools that offer the Communication Sciences and Disorders program. So does the state of Alabama. So where can an SLP work? We can work at schools, hospitals, private practices, physician offices, universities, colleges, rehab center, long-term facilities. As a speech-language pathologist, we get the opportunity to work with individuals across the entire lifespan. So from a baby that's a day old all the way to the end of life. The salary of a speech-language pathologist varies based on the region that you live in and the state that you live in, as well as the setting that you work in and your experience. Speech-language pathologists make between $40,000 a year to 6 figures. As a speech-language pathologist, we have the opportunity to work full-time, which is usually 40 hours a week. We can also work part-time. Part-time varies for each job, so some jobs may say part-time is 32 hours, other jobs may say part-time is 36 hours, or it may be somewhere in the middle there. We can also work per diem, PRN, which means as needed. Some people do not know this, but speech therapists, we can travel. You can be a travel speech therapist. As a traveling speech therapist, you can go to different cities, different states, and work short-term contracts, usually between like 6 and 12 weeks. So I guess you can say I am a medical-based speech-language pathologist. I primarily work in acute care hospitals and I absolutely love it. In the acute care hospital, I primarily work with adults and geriatrics. I work on all the floors in the hospital, from the emergency department to the oncology floor, to the intensive care units, to the neuro floor, COVID floor. Any and all floors of the hospital, you'll find a speech therapist. I do a lot of evaluating and treating of swallowing disorders. So I work with a lot of patients who maybe had a stroke. Probably 70% of my day I am treating and evaluating individuals with swallowing disorders. It can be a swallowing disorder secondary to someone having a tracheostomy tube, secondary to someone having a stroke. secondary to someone having a traumatic brain injury from a car accident. When I am at work, I have the opportunity to collaborate with a radiologist assistant and a radiologist to perform a study called the Modified Barium Swallow Test. I give my patients barium, they drink the barium, and I get to watch inside of their mouth and inside of their throat to make sure that the food is going from their mouth to their throat to their esophagus instead of going in their airway. By completing this evaluation, I am able to diagnose the patient with the severity and the type of dysphagia, as well as come up with a treatment plan to help this individual return back to their baseline diet. The other percentage of my day, I am assessing and treating individuals with expressive language disorders, receptive language disorders, and cognitive linguistic disorders. Cognitive linguistic disorders include problem solving, short-term memory, long-term memory, planning, organizing, sequencing, all that good stuff. Expressive language disorders is how someone expresses their wants and needs. It can be verbally or it can be through gestures. Receptive language is understanding, so how an individual understands what someone is saying to them. So I know you're probably wondering, do I always speak standard American English? No, I do not. Do I always speak African American English? No, I do not. I code switch. Thank you again for tuning in. I hope you learned at least one new thing about the career of a speech language pathologist. Make sure you like this video. Drop a comment below of any questions that you have about the career of a speech language pathologist. Subscribe to this channel so you can receive a notification for the next video. See ya! Oh, it cuts my hair off. This thing does this every time. Every time you hit record, every time you hit record, it changes the view of it. All right. Talk how you talk. Talk how you talk. All right, let me see if I can get some stuff. Let me see if I can get some stuff done. See ya. See ya. Girls, say it is what it is. You know. I think that's a wrap.